Osteopath Dr. Michelle Funder runs her own practice in Melbourne. Her clientele come in all shapes and sizes.
And how did you feel after the last treatment, do you remember? We treat a lot of footballers, local community netballers, especially on a Monday morning after a heavy weekend of sport. We also get a lot of desk workers, postural strains, people come in for chronic headaches and migraines. But really it's a wide variety, so any musculoskeletal injury. So I'll get you to nice and slowly bend forwards towards your toes if you can.
In treating any injury, getting to the source of the pain is paramount. And in Michelle's business, it's all about the holistic approach.
So you're feeling it quite low down?
Yep.
In through there, okay. Osteopaths will assess not only the area of the symptom that's giving you the injury, but the whole body. So for example, if you are coming in with low back pain, we're not just looking at your lower back, but the spine above the lower back, your hips, your pelvis, your knees, your feet, your ankles. We're trying to really problem solve as to what the root of the cause is for that low back, because yeah, the symptoms are in the lower back, but perhaps it's that knee on the left that's a little bit weak, or you've had an old fracture in that that's actually driving that chronic low back pain. So bring the feet slightly closer together.
Adam Sassy is a personal trainer. After a groin injury impacted on his lower back, he's been fronting up for treatment with Michelle for the last 4 weeks.
So we're going to just have a feel of how the hips move.
It's quite a debilitating injury.
A bit tight.
I had my condition a little over 12 months. At times it's been worse than other times over that period, but it's flared again whilst training for marathons.
Perfect, and I'm just going to check your leg lengths. Osteopaths have a lot of different tools in their belt for treatment techniques. So generally there'll be some soft tissue work, dry needling, which is great for trigger point release. We often use spinal manipulation, which is a very gentle mobilisation of the spinal joints. A technique called muscle energy technique, which is about stretching the joints and helping relax them. Try and keep that left leg nice and still. We're very much into exercise prescription, so helping rehabilitate injuries to make sure that we can reduce the injuries occurring in the future. So I'm just going to have a bit of a feel through your back.
So I had physiotherapy initially, and with their treatment was also a suggestion of rest, which helped to a point. I believe that seeing Michelle has helped me with really focusing on the back and those muscles in the back to loosen up, particularly whilst continuing to train.
It's feeling a lot better than last week through those tissues. I think that the top similarities between all of the professions is that our number one goal is about the patient and helping them on their journey to help with their injuries or whatever they're presenting with. I often say to clients, as long as you've got a good connection, you trust the person that you're working with and you're starting to see some results or understand why you might not be seeing results, that's probably the most important thing. How does that feel through there?
Feels fine, yes, feels good.